We are so fortunate in Howard County to have two physicians representing us in the state legislature. I want to acknowledge and thank Senator Clarence Lamb and Delegate Terry Hill. Like many in our community, they have stepped up to contribute their talents and skills to lead our medical response to the COVID-19 coronavirus pandemic.
This is a remarkable time for our state, our country, and indeed the world. As one of 3 doctors in the Maryland legislature, the early adjournment of the General Assembly in March allowed me to step back into my other role as a physician at Johns Hopkins. In addition to seeing patients every week, I've also been serving as the interim director for occupational health services at Johns Hopkins Medicine and Johns Hopkins University since the COVID-19 pandemic started. It's been a tremendous responsibility to oversee the health, safety, and well-being of the 20,000 employees who work in the academic programs and the schools of the university, as well as the 30,000 employees who work in the 5 hospitals of the Johns Hopkins Health System spread across Maryland, D.C., and Florida, many of whom are healthcare workers working on the front lines of caring for patients who have contracted COVID-19. In the practice of occupational medicine, our employees are our patients, and their health is critical in protecting our patients and ensuring that we have a healthy workforce ready to treat anyone who comes through our doors. During this pandemic, the responsibility of safeguarding our healthcare workers has never been more challenging. These include determining how to best protect our employees with personal protective equipment, screening and testing employees who exhibit symptoms of COVID-19, ensuring those who require treatment get the help that they need, and making sure those who are ready to go back to work are safe to do so, all the while being mindful of maintaining a healthy and adequate workforce of clinical employees ready to respond to rising COVID cases in the middle of a pandemic. It's been an all-consuming job over the past month, with 12 to 13-hour days nearly every day of the week here at Johns Hopkins Hospital in East Baltimore, but I'm committed to doing everything it takes to ensure that our thousands of healthcare workers who are also committed and continue to work during this pandemic remain healthy and safe.
My practice is largely elective. So we've had to essentially shut down. A lot of my practice is non-elective, so I still see patients who have cancer diagnosis. I still see my post-op patients to make sure that they're recovering well. I'm available to see people who are having trauma. So, we have people who are still cooking at home and more than usual. So if they get a burn or they accidentally slice their hand with a bagel, then I'm making myself available to their doctors to refer them into me and bypass the urgent care centers, bypass the emergency room, and take care of those kinds of things. What I've done with, I think, a vast majority of my colleagues have done is I've signed up for the Medical Reserve Corps, which includes volunteers without medical background, but also includes professionals, so nurses and physicians and physician assistants and nursing assistants and all of that kind of stuff. So I signed up for that. I did the same thing back after 9/11. And so keeping myself available to fill in where needed. I think what we're seeing here in Howard County is the numbers are still going up, and the hospital has been able to increase their capacity. And I know that I'm and some of my colleagues are sort of waiting for whether or not there's going to come a point where they need some relief. So the hospital sent out inquiries last week about, okay, if you're in the community, what would you be willing to do in the hospital if our regular staff get overwhelmed? So that's what's going to happen if there's a surge. We're going to hope that, that we have sufficient resources in the community to fill in so that the regular hospital staff are not overwhelmed. I actually have the nurse who works for me in my office went and volunteered up in Boston. And we just got word a couple days ago that she's now tested positive.
I know that we live in a challenging environment these days, but I also know that we will get through these difficult times together and emerge stronger as a community. Marylanders are resourceful and resilient, and I want to thank all of you for doing your part.
Please remember to be compassionate and generous to one another during this challenging time. Please stay home and save lives. By doing so, you've been helping to flatten the curve. Let's continue together in that effort. And please stay updated by visiting howardcountymd.gov/coronavirus.